Okay, we're back. We're live. It's Tuesday here at 2 o'clock, and we're talking about Hawaii and Hawaii's state of health. We call this show, which is promoted by the Department of Health of the state of Hawaii, the Hawaii State of Good Health Show. I added the good health because I feel strongly about good health. And we have Jessica Yamauchi, who's the executive director of the Coalition for Tobacco-Free Hawaii. Right over there. Say hi, Jessica.
Hi.
And we have Lola Irvin, who is from the Department of Health Tobacco Settlement Special Project. She's the manager. Am I right? Did I get that right?
Yes.
Okay. Welcome to the show.
Thank you.
So, okay, let's define terms first, and then we get into some of the current events around the subject, and there are current events. Can somebody tell me what is, I think you're probably better on this, Jessica, what is the Coalition for Tobacco-Free Hawaii? What is that?
So we are a nonprofit organization, and I'm actually probably going to confuse it a little bit. We've actually expanded our mission as well. So the coalition has been around for more than 10 years and recently expanded its mission. So it's now actually a program of the Hawaii Public Health Institute, which is dealing with more public health issues.
Which is another nonprofit.
Well, we're all one nonprofit.
Okay.
So the coalition exists as a program of the Hawaii Public Health Institute. And the coalition really works towards reducing tobacco and use in Hawaii, and also secondhand smoke exposure.
Are you telling me that the people are still smoking in this state?
Believe it or not, there are.
It's hard to believe.
There are.
You have a number or a percentage or anything that you could scare us with?
Well, I'll let Lola give you the stats from Department of Health, as I know they usually have all of the stats right off the top of their head with their different surveys that they do.
Okay, so the coalition works to try to reduce the use of tobacco in the state of Hawaii.
Yes, and we mostly work through, well, we are a coalition, so we do grassroots buildings, we bring our partners together that are interested in the same issues, and we work on making policy level changes, whether it's with organizations, county level, state level, but we really are looking at making macro level changes that are going to affect the greater number of people.
So would you be seeking legislation either at the state or county level?
We are currently seeking legislation at the state level.
What kind of legislation would you be seeking?
All kinds.
Okay, I'm sure. When there's one, you always find more, you know. It's never just one bill.
So, no, correct. So there's several different initiatives that we have going on this year at the state capitol. A couple are around electronic smoking devices, also referred to as e-cigarettes. We really are trying to get them included in our smoke-free workplace law, so that anywhere smoking is currently prohibited, e-cigarettes would now be prohibited. We also are looking at a permitting process for both wholesalers and retailers of electronic smoking devices.
Okay, that's pending in the current legislature.
Correct.
Chances are good that will pass, it seems to me.
Let's hope.
Yeah, okay.
We never know.
No, you never know.
It's still early,
It's
but we are
building,
hopeful. Yeah. We're also working on raising the age of sale of tobacco to 21. Which is really exciting. It is currently 18, except on the Big Island. The Big Island passed their own county law in 2013. So on the Big Island, they have raised it to 21, but the rest of our state has not done it, and we're looking to try to do it at a state level.
Isn't that a preemption issue where the state should rule on such a subject rather than by county? It seems to me, you'll agree with this, I know you will know, that health is a statewide matter.
It is, so it's interesting that you bring that up. So at the Honolulu County level, we also had the same initiative that we were working on, raising the age of sale to 21. And Honolulu County did feel that it was a state issue and that there was a preemption issue. So they deferred to the state legislature to really take action. I think there are a lot of public health matters that you can do at the county level. Our smoke-free workplace law that now exists at a state level first was really passed through each county at a county level first. So it depends. Hawaii County did it. They didn't feel it was an issue, but Honolulu County was definitely a little bit more conservative, and based on council, felt that there was a preemption issue.
No, it should be, knock wood, it should be an easy
Let's
bill.
knock on wood.
Yeah. You have to get down to the legislature now and testify or something?
Not today. Today's a good day.
Okay. So one other question is, before we go off to Lola, is what is an e-cigarette exactly? I see them in the stores. I cannot for the life of me understand how that works. it doesn't sound consistent with whatever drew people to tobacco in the first place and why they would be drawn to electronic tobacco or whatever it is. What is it? And why would I ever consider using it for my body?
I don't know that I have all those answers. I will say they are growing in use. They are changing all the time. They have all different kinds of models and price ranges. And I think, you know, what we're really seeing is they've been able to market them really well to youth, and they have made them blingy and cool looking. A lot of times they don't resemble a cigarette, and parents aren't even aware that their child may be using one.
Well, how does it work? Are you sucking something into your lungs?
Absolutely.
And what is it that you're sucking into your lungs?
Different chemicals that are in it.
Oh, that's refreshing.
And they're completely unregulated at any level right now. So the chemicals that are in it really vary from e-cigarette to e-cigarette. In December, there was an article that came out by the New York Times that actually stated that more than 90% of all the e-cigarettes manufactured are manufactured in China, which is really scary because there's very little oversight that happens. And then when they come here, there's no rigorous testing that they go through at all because there's no regulations on them.
Yeah, might be melamine.
I think
you remember that one.
I do remember that.
So I just one more question, and then
Sure.
I want to introduce Lola, and that is when you talk about tobacco and the coalition, all that. Ready for this one, Jessica? Are you also talking about marijuana?
No, we are not.
Okay.
That is not an issue that the Coalition for Tobacco Free Hawaii has taken up, and the only time we sometimes overlap, we do deal with a lot of complaints from condominium owners who are suffering from secondhand smoke, and sometimes they are also suffering from secondhand marijuana smoke, and that's really the only time we've found that our issue overlaps.
It must be pretty funny, actually. I smell something from that apartment just below us. It's got this sweet smell. What am I going to do?
Yes.
It may become legal, you know. So as I understand, Kalani English from Maui, the senator, is trying to get it legalized. A lot of others too. It's got some, what do you call it, traction in the square building.
But yes.
Yeah. You don't take a position on it at all.
We are not at this time.
Okay. So Lola, you are the manager of the Department of Health Tobacco Settlement Special Project.
Yes.
This was a project that was established in a great big global settlement around tobacco and cancer. And the state of Hawaii was a party to that settlement. A lot of states were. And the tobacco industry funds the settlement over time. So it's not one great big whammy payment, it's over time. So can you tell us how much money, I mean, if you can, how much money comes into that global settlement and how much money comes to Hawaii and over what period of time?
Okay. Hawaii is one of 46 participating states. So Hawaii's portion right now is about $50 million a year. In 2018, that portion will go down to about $41 million. So Hawaii gets a small percentage from, 46 states that are participating. From 2009 to 2017, Hawaii is getting some incentive dollars. That's why we're getting about $50 million. We were one of the first states to help settle. And so because of that, we're getting a little bit more. But in 2018, it'll go back down to $41 million. Now, having said that, this is from the profits of the participating tobacco companies. So Hawaii smoking rates are the third lowest in the nation.
Good.
Yes, very good. We're very thrilled with that. And we want to see smoking rates go down nationally. As other state smoking rates go down, then we do anticipate profits should go down to the tobacco companies, which means then our portion of their payments will also go down.
Yeah. Well, that's good and bad. That's really a double-edged sword. I hope this doesn't depress you with the thought that one of these days the coalition is going to be out of business.
We have always said if we do our job right, then we will not have a job.
Right. Okay, but that's not, that's going to happen. And by the way, the settlement does not include anything about e-cigarettes.
Correct.
Or for that matter, marijuana. It's all old-fashioned classical cigarettes.
Yes.
Which means it's locked into that notion. And if we you know, to decrease the number of people smoking, number of cigarettes smoked, theoretically, there's no money. I mean, at the zero, there's no money in the fund at all.
Yes. Though,
you'll be out of a job too.
Yeah, and that's okay. I mean, if we see tobacco rates go down to 0%, that's fabulous across the nation.
Okay. All right, so 41 for now. Where does the 41 go?
Actually, 50 for now, 41 by fiscal year 2018.
Okay, got it.
So where does it go? The Department of Health gets 15% right now, and we use that for tobacco prevention and other chronic disease prevention programs.
Does any of that go to the coalition?
No, not from there.
Not that part.
But there's a 6.5% that goes to the Tobacco Prevention and Control Trust Fund. That portion is then managed by the Hawaii Community Foundation, and out of that
Right
we
up
do.
the street here.
Yeah.
Yeah,
Yes,
okay.
and they do a fantastic job. And with that, then we have community grant making, and the coalition is one of those organizations that gets funded. And
Through the Community Foundation.
through the Hawaii Community Foundation. We also fund the Hawaii Tobacco Quit Line. So that's
Quit line.
completely funded, yes, by the
It's
trust
like
fund.
a hotline, except it's quit instead of hot.
That's right. So you don't have to go.
When you're having withdrawal symptoms and you call in the middle of the night. Or
Oh, I hope people call before they hit that point so that they can have a relationship with a counselor.
Good.
But they can call and they can get 2- and 4-call counseling sessions set up. They can even get nicotine replacement therapy mailed to them.
No kidding.
So,
It's
yeah, we
offering
do
a
that.
whole spectrum of services. Then.
Yes, we do. And then at the community level, the grantees also then provide face-to-face counseling, which for some people that works better than doing it over the phone.
So okay, is it all used up, or do you keep any of it on a going forward basis?
Like an endowment?
Yeah, a
Yes.
residual going forward.
Yes,
or
we
is it-
do. We keep a principle of it moving forward. And so we're spending some of the revenue and the interest earnings. But you know, the sad thing is because of the recession and to meet the budget shortfalls, for 2 years the trust fund portion got diverted to general funds. And so to keep the programs going, we have been spending from the principal of the dollars. So that portion, the principal, that's supposed to move forward and is supposed to be invested and behave like that in perpetuity, it is going down. So we are going to have to tailor back the breadth of our programs so that we can maintain.
Yeah, because you don't want to spend the endowment.
Yes.
This reminds me of, actually reminds me of our program next week.
Mm-hmm.
We have a program next week called Hawaii, the State of Unfunded Liabilities. Okay, and we figured it out. It was something like $40 billion, this and that. You know, and we have a whole list. In this morning's paper, there was an article about it. You know, that's the problem in these times. We were never right since 2008, and we have all these pressures on fiscal pressures. By the way, Calbert Young, if you remember him, is
Yes.
budget and finance, a wonderful man, is part of this program. Anyway, you know, we're not flush in money. Sometimes we have to raid these funds. And the classical one is the barrel tax, which was established for a single purpose, such as the tobacco settlement for a single purpose. And the legislature rated that pretty good, so that originally the idea was you pay a barrel tax so that we could go on clean energy, and now it goes in this direction and that direction. And what it teaches us, and I think if you want to write this down, please, is that the legislature gives and the legislature takes. With the stroke of a pen, they can undo anything. So if you thought at the outset the barrel tax was carved in stone and inviolate, nope, it can be taken away. If you thought at first the tobacco fund was carved in stone and we knew exactly where it was going to go, nah. But you can get it back if you go and you lobby for other legislation that will bring it back. Are you doing that?
We are asking that we have some monies back. So the way the budget shortfall was met and money is diverted, in 2016, fiscal year 2016, Department of Health should go back up to 25%. And then the trust fund portion will go up to 12.5%. However, the original portion to the trust fund used to be 25%. It will not happen. So, yeah, we are asking that that part of the budget remain and that it not be interrupted so we can get the portions back.
Yeah. The legislature should find other ways to raise money to pay the bills. These should be inviolate. I think a lot of people are with you guys on that. Yeah. Anyway, that's Lola Irvin. She's the manager of the Department of Health Tobacco Settlement Special Project, handling the money in the tobacco settlement, and Jessica Yamauchi, who is the executive director of the Coalition for Tobacco-Free Hawaii. We're going to take a short break, and we'll have a smoke or something, and we'll come right back.
Aloha, I'm Kili'i Akina, president of the Grassroot Institute and host on Ehana Kako, a weekly program on the ThinkTech Hawaii broadcast network. Ehana Kako means let's work together. Think of the sad alternative, let's not work together. Here in Hawaii, with all of our diversity and the richness of the people, it's important for us to come together around issues on the basis of what's right and what's good and what's going to serve the common good. And that's what we try to do at Ehana Kako. Every week, we interview movers and shakers, people in government, business, and other sectors of society to talk about how to create together a better government, economy, a better world here in Hawaii that can bless the rest of the world. I thank you for your attention to ThinkTech Hawaii, and we look forward to seeing you every Monday, 2 to 3 p.m. on the ThinkTech Hawaii Broadcast Network. We're Ehana Kako, and we wish you well. Aloha.
Okay, this is Hawaii, the state of good health. And the title of the show, I have to mention, is Smoking Still Kills, just in case. And I was only kidding about taking a smoke break. That was just a joke. Okay, and we have Lola Irvin from the Department of Health, the manager of the Tobacco Special Project, Tobacco Settlement Special Project, and Jessica Yamauchi, executive director of the Coalition for Tobacco-Free Hawaii. Now, I heard by a little birdie told me that you guys had a press release just today. What happened? Where? What happened? Tell us everything about the press release. You guys both there?
Yes.
We were both
We
there.
were both there. We were celebrating. So, you know, it's been 15 years since the settlement was arrived at, and we every year follow the data and look at how are we doing performance-wise. And this year we were able to report that youth smoking rates have gone down 63% since 2000. Adult smoking rates have gone down 32%. And then we've also seen deaths due to heart disease and stroke and lung cancer go down. So let's see if I can look at my data here. Deaths due to heart disease decreased 34%.
Interesting how that's so close to the number, the
Yeah.
reduction number. Yeah.
And stroke went down 41%. This is the first time we've seen lung cancer death rates go down, and it went down 11%. And that's using 3-year aggregates. Our epidemiologists, really carefully calculated the numbers to show that it is indeed trending downward, and that reflects on the fact that people have quit smoking, and on the front end, the youth have not started.
Yeah. Well, that's very impressive on a number of levels. I mean, one is that there's no question on a demographic basis, public health basis, that there's an association between tobacco. In case you were wondering, it does kill. And if you stop taking it, there's a huge benefit. I think that there was a time when people said, well, I've been smoking all my life. I can't quit now. The damage is already done. If I'm sick, I'm already sick. So, but that's not really true. You can quit any time in your life and have a benefit. And here's an example of a whole state that has benefits. It's wonderful that we've done that. And it's also, my second point, it's wonderful that we have the numbers, Good for you guys that you keep the numbers, because it's really important that we navigate, that we know where we are and what's happening to us. And I think that's a great service by the Department of Health that you do that. It's medicine these days in the 21st century, it's all about data. It's all about community data, diversity data, finding out where we are. That's one of the reasons I think we're so successful in public health here. Comment?
Yes, and the other part is, it's about people's health. The other thing is it's about our wallets. So in terms of our economy, we also did the numbers and showed that with the deaths averted and healthcare costs averted, for every dollar we spent, we saved $4.63. And so prevention also saves money. It saves lives and it saves money. So we wanted to share that with our public.
So we haven't finished talking about the press conference. So it was the good numbers.
Yes.
That was the reason for the press conference. And was the press interested?
Absolutely. We were very happy with the number of media outlets that showed up for the press conference, the interest.
Yeah. So, well, I guess, you know, from your point of view, Jessica, it just seems to me that you're interested in trying to change the way people live their lives. It's the habits of the individuals, the habits of the community. I mean, I think there was a time, I remember my parents, you know, smoking was part of their lives. They smoked all day.
Yeah.
We had a great big ashtray, had trouble remembering that word, ashtray in the middle of the kitchen table, and it was always filled with butts, and they were always smoking. They could not function, actually. It was a sort of a psychological, could not function without that. Thankfully, we don't have that now, because a lot of people would object to that, even if it wasn't illegal. But you still have to get them at home, where they live, and how they deal with stress, and how they deal with habits. How do you do that? How do you achieve the numbers that Lola was talking about?
Well, I think a lot of it has been over time and really changing the social norms. Like you say, you know, if you think back to what it was like with your grandparents, and, you know, we...
No, they're just my parents.
Or your parents, sorry.
My
with your
grandparents
parents.
didn't have any money to buy cigarettes, so.
with your parents, and how different
Don't make it worse than
it is today, right? My children don't know what it's like to go to a restaurant that allows smoking, you know, and it's amazing when we get a policy passed that impactful, how quickly the social norm changes, and I think that's a huge part of the equation to reducing tobacco use, and especially among our children. When they don't see it around, it's not being portrayed as being cool anymore, you know, that's when you really start to see the differences. We also know that tax increases really do help as well. So every time there's a cigarette tax increase, it will encourage some who are currently smoking to quit, but it also really helps prevent youth from starting, because youth are so price sensitive. And so every time we have an increase, it does help prevent youth from starting.
Yeah, well, it's like people do respect government. They may yell and scream and shout at them, you know, and write stinky letters to the editor about them, but they do respect government. And so if you give a message to the community and say, we in the government, we've studied this, we have stats on it, you know, this is an initiative that arguably is a democratic vote, you know, a collection of experts, they feel this way. And you say that to people, I mean, in no uncertain terms, and you adopt policies and statutes and whatever it is, prohibitions and taxes, you're going to change public opinion over time. They're going to stop doing that. You know, I was telling you before the show that my law firm years ago represented a number of the downtown office buildings, and we were sitting having a conversation with one of our clients, and we said, hey, why don't you cut out smoking downtown? You know, try it, see what it is. And they did in this one building, just one building. And before you know, and so we changed the building rules, right? It was we only required that. You can't smoke inside the building. And so now that some of the tenants were upset about that, but most of them went for it. And the next thing you know, the next building. Next thing you know, the next building. This is before any ordinance, before any statute. These buildings all voluntarily changed their rules. I think it was probably a matter of, you know, keeping the building clean.
It's part of it.
You know,
right.
simple like it. But you know, in a matter of a couple of years, it didn't take very long. Every single downtown office building here on Bishop Street had rules to say you can't smoke.
You were a trendsetter.
And that cut out a lot of, yeah.
No, it is, and it
firm
doesn't
is proud
take,
of that, you know.
it's something to definitely be proud of, I think. And we're seeing the same small steps kind of happen with e-cigarettes now. And so, as you know, e-cigarettes are not currently covered in the smoke-free workplace law. They were not around when the smoke-free workplace law passed. And so right now there's not any law prohibiting you from smoking them in restaurants. And so what we've seen,
right? But
what
people
we've
must object. The guy at the next table must hate that. Because you can smell it, right?
Oh, yes.
Well, yeah, and you can see it, and people
It's real
get
smoke.
confused about it. And
They think
so
it's
we have
poison.
seen, well, and it could be, right? There are chemicals that are being released in that vapor that's coming out, in the aerosol that's being emitted. And I think, but we've seen some steps. So we've seen some private companies go ahead and prohibit it. The city bus prohibited on the city bus, consolidated theaters So a bunch of restaurants have, and then Department of Health was the first government agency to prohibit the use on all of the Department of Health campuses. Then before Abercrombie left office, he did an executive order that required all buildings under Department of
Accounting and General
Accounting and
Services.
General
State
Services, virtually all state buildings. I think there's a few that don't fall under DAGs, but basically almost all state buildings now prohibit the use of them. And because last session, I will tell you, we would go into lawmakers' offices and there would be employees actually using e-cigarettes in the offices, and it wasn't against any law.
Does e-cigarettes, solve the habituation problem that cigarettes create? In other words, if I gave up my cigarettes, but I still have a longing for them, are e-cigarettes going to make me feel better? Is that what it is?
Well, they do contain nicotine in them, so they are satisfying that craving. But I think it depends on the user. Some people seem to feel that it does satisfy that craving. Others don't, so I think it really depends on the user. I think the more concerning part is that they really are picking up a new market share where people who are not cigarette smokers are using electronic smoking devices.
That takes me to the whole issue of, we spoke earlier about the kids. People make these decisions. I remember, sorry about the personal story, I remember I went into college and a whole bunch of us, were pledging a fraternity. And I remember this like yesterday, and we said, are we going to smoke or not? It was a group of us. It was probably 6 or 8 guys. And I said, yeah, we're going to smoke. And we all agreed that we were going to smoke. And we smoked for a long time. Ultimately, everyone gave it up. But we all smoked because it was a peer group thing, and we were that age. And once you make that decision, you're locked into something. So my question goes back to the whole thing about the millennials. We don't want them smoking. We have got to stop that for their benefit, but also for the community benefit and for the community health benefit. How do we do that? How are you doing that? Are they listening?
They are. It's amazing. We have some of our staff that's able to go out to schools and really educate some of the students, particularly schools that are having a problem with e-cigarette usage.
High schools.
High schools mostly, sometimes middle schools.
Really? Wow.
And so what's alarming is that most of them that are using it have no idea that it's potentially dangerous for them and that it could be harmful. That message has not been made clear to them at all. And so they all feel that it's a very safe product and that this is just something cool to do.
That's where you got to stop
And
it,
so,
right there.
Absolutely. Absolutely. So, we've been talking about the need for some PSAs that need to really start delivering that message.
Go ahead.
Okay.
Tell the kids about this. Just give them 30 seconds.
The message is to the kids and to the parents, really, that, you do not want your child starting on e-cigarettes, that they are potentially addicting. We don't know the chemicals that are in there, and we don't know the long-term effects, the health effects on them. And so we don't want to see this new market share really starting on e-cigarettes, getting addicted. And we see e-cigarettes as potentially being the gateway to other tobacco products now.
So I want to talk about the crossover between, I don't know if it's marijuana or the old-fashioned kind of rolled-up cigarettes. This question has come to me from our staff, who is not involved in any of this, okay? But just as a matter of curiosity. So you can go into a lot of stores and buy rolling paper, and everybody knows what that's for. And that, presumably that's for marijuana, unless you buy tobacco by the by the bag full. How do you stop that? Can you stop that? Is that subject to the same rules about smoking? Where do you nip that one in the bud for millennials who may think it's very glamorous to roll their own?
I don't know that I can speak on the marijuana issue.
When you roll your own, there's no filter.
There's
no
filter.
When you roll your own, you're getting a full shot, whatever it is.
We know that there was a spike in roll-your-own shops a few years back. It does seem like that's kind of been curtailed a bit. And I know that there was some federal regulations that went into place that didn't allow you to go into a roll your own shop and actually purchase everything individually and then actually be able to leave with a manufactured cigarette because they had the machines there to use.
Okay, you
So
use the
you
machines.
can, right, so you can't do that anymore because if you leave with what looks like a manufactured cigarette, then that shop is supposed to be registered as a tobacco retailer, pay into the master
And
settlement.
the age limit applies.
Everything applies, right?
Yeah.
And
Good
so
work.
we know that that's not our work, but thank you. We were happy to see that come into place because I think it really did help a lot of these shops end up closing down. But we do know that you still can't. It's still legal to go and buy all of the ingredients separately and go home and roll your own. It's fine to share your machine with your neighbor if that's what you choose to do, but you cannot charge to actually use the machine.
Yeah, well, it's a charade
So-
is what it is. Nobody can convince me otherwise. Before we go to the break, Lola, I wanted to catch up on one other point, and that's the Cancer Center. It's been involved in the news lately. You know, it takes, what, $20 million has been the customary contribution out of the tobacco fund to the Cancer Center. That was intended to stop cancer and stop cancer activities, cancer-creating activities. So you guys were giving, what, $20 million to the Cancer Center?
Well, that was out of the tobacco tax, not the settlement dollars.
Ah, okay. That's the tobacco tax. What about the settlement?
The settlement dollars, actually, there's a 27%. This year, it will be 26% that goes to the School of Medicine for that beautiful campus in Kaka'ako. And so the tobacco settlement dollars back in 2000 were recarved up and were what had been 25% for tobacco prevention and control, 25% for chronic disease programs. The prevention and control trust fund dollars got reduced to 12.5% to create a 28% portion for the School of Medicine. The Cancer Center has been getting their portion of dollars from the tobacco tax. So that's
Not from your fund.
not from the settlement, yes.
Interesting. Well, if you, just one more thing, and we'll go to the break. Okay, whether it comes from tobacco tax or the settlement, the idea is that this is a sort of a special allocation to what? Research and health facilities like the School of Medicine and the Cancer Center. For them, as a matter of policy, it's sort of like the barrel tax, you know, trying to create green energy and get off fossil fuel. So you want to give them the money so that they can do what to help stop smoking and therefore cancer? I mean, is it like a research grant? Is it operational? How does that work?
Well, you know, researchers from the School of Medicine, and I don't know if any researchers from the Cancer Center have applied, but in the past when we have, through the Hawaii Community Foundation, put out competitive community grant opportunities, the researchers have applied for funding and gotten funded. So for example, very early on, there was a UH project that worked with tour bus operators because they smoked at a very high rate. And so it was a research project to create an intervention and to learn how to really best approach people who are in the bus, and this is before the smoke-free workplace laws were passed, and to provide them with the support. The portion that goes to the UH School of Medicine, that 28% now down to 26% actually pays for their debt service. So it basically pays for a mortgage. It doesn't pay for any research.
And it frees up other funds for them to do research, though.
And I'm not familiar with their, how, you know,
Yeah,
they do
understand.
their finances.
Yeah, but I mean, putting that aside for a moment, is there research going on these days in Hawaii, either at the Cancer Center or at the School of Medicine, to deal with lung cancer? You know, the effects that you just read off, the connection between tobacco and all these, you know, chronic and often lethal diseases.
I'm not sure about lung cancer, but there are those who are doing studies on e-cigarettes and youth use of e-cigarettes, also in terms of novel tobacco products like cigars. And then
Cigars,
yeah. Well, youth use of
Antisocial.
other tobacco products, including cigars, has gone up. And so we're really concerned about youth experimentation. And with other tobacco products, the prices are lower than cigarettes, right? We have very high cigarette prices, but the other tobacco products are really easy to purchase. They're in terms of price-wise, and so we're trying to see that the price would be more equitable to cigarettes.
So it sounds like that the real payload here is to stop people from smoking.
Oh, indeed.
That's what this is
Correct.
really all about.
For
To
health.
change public mores so they stop smoking.
Yes.
And if you do that, then all the other effects, as in your press conference, all the other effects flow from that. Yeah.
You nailed it, yes.
Yeah.
That's right.
Okay, let's take a short break. We'll come back and we talk about the challenges and the future. We always do that. Okay? That's Lola Irvin. She is the manager of the Department of Health Tobacco Settlement Special Project, and Jessica Yamauchi, who is the executive director of the Coalition for Tobacco-Free Hawaii. And we're calling this show Smoking Still Kills. Indeed, here in Hawaii, the state of good health. We'll be right back.
Aloha, my name is Josh Green. I host a show called Healthcare in Hawaii here on ThinkTech. We get together once a week or sometimes twice a month. Depends when we're busy. We get together less often, but we love to see you here to talk about the preeminent healthcare issues in our state. Our programs vary very widely. We talk about economics, we talk about healthcare, we talk about social issues on this program. Thanks for joining us.
Aloha, my name is Paul Jackson, better known as PJ, and my local interest is in sports. I have my own sports radio show at KWAI AM 1080 that you can stream live. I also have my own website, pjsportsradio.com. We have live guests in studio, and we talk about discussions and topics that everyone wants to know locally here on the islands. We cover everything from surfing to basketball to whatever's going on locally, sports-wise. We try to do our best and cover the topics in depth as much as we can. Once again, thank you for joining PJ here on Hawaii Sports Update. Mahalo.
Okay, we're back. We're live. We're here with Jessica Yamauchi and Lola Irvin talking about tobacco and the Tobacco Coalition for Tobacco-Free Hawaii and the Tobacco Fund here. And I want to get a handle on how this moves forward. I mean, your job is not done. There are still people in Hawaii that are smoking, and they're enticed also by the electronic cigarettes. We have got to stamp it out completely. How is this going to unfold going forward? Is there an expectation, a plan? How do you see it going forward? Lola?
Okay. Well, we continue to ask that everybody stay focused. And we went to fight, and we settled with the tobacco company so that we could have monies for prevention, to prevent youth from initiating, to help people who smoke quit, and also to work on chronic disease. We have about 67% of people in Hawaii who've already been diagnosed with one chronic disease, and about over 40% who are dealing with one or two more chronic disease diagnoses. So we need these dollars to remain focused, and we need to stay the course. And so it's really great to have partners too, like Jessica, because then they're working on the policy part, because we need a comprehensive effort, policies as well as interventions. And you were actually working on systems change, and we love that.
Okay.
So yeah, from the beginning you worked on that, and so we rely on partners to do that too.
Yeah, that's great. So how do you see it unfolding, though? Where is this all going? Are people are the hard cases, the remaining cases, or the cases at risk, like maybe these kids, young people? Are they getting it? How do you think that's going to unfold?
You know, there are some people who are smoking at much higher rates.
Really?
So we're really concerned, and we're trying to reach deeper. We have community cessation grantees that are actually going out to see the homeless because they smoke at a higher rate. We have people who have mental health issues. They smoke at a 30 to 40% rate compared to 13% overall.
Kind of suicidal, isn't it? You know,
It is
to
really
smoke that
sad,
much.
because then also then what happens is they die earlier from chronic disease. They die 25 years earlier than the rest of us. So yeah, it is really sad. And then they're marketed to very heavily by the tobacco industry. So we have a lot of work to do. And then with our youth, the e-cigarettes are working in terms of marketing to them with great flavors and a lot of the technology that allures them. And so yeah, in terms of unfolding, tobacco industry is really smart, very stealthy, and they settled because it was a good business move.
Sure. It wasn't for love.
It wasn't for love. It wasn't for generosity. So we know that moving forward, Jessica and I will be working hard because we will also always have this issue because they are very nimble.
The pernicious thing about all of this is that those diseases that tobacco use creates are long-term chronic diseases. They're disabling diseases.
Yes.
They're lethal diseases, and they ruin lives. And if you don't have the money, or God forbid, you don't have the health insurance at an age where you're vulnerable, then you're going to become a public charge. And that means the rest of us have to pay for your smoking habit, which is really not exactly what we want from a public policy point of view. Disagree?
I agree. Well, and then the other part of that too is 90% of people start smoking before they're 21. Right? So we also know that our kids are making decisions based on millions of dollars of marketing. And so I don't want to make it a personal responsibility issue when it's one person up against a multi-million-dollar advertising campaign.
Uses psychology all day
Yeah.
long. The best psychological analysis they could find. So, query, as a matter of public policy, okay, I ask this to both of you. Do you foresee a day when tobacco use in this state will be against the law in general?
I don't think we would support such a policy in terms of making tobacco use illegal. I think people will be able to make that decision. It has an impact, though, on the other person. So if I smoke, I impact Jessica and you sitting next to me with my secondhand smoke.
And the small children.
And the small children who have no option. They have to stay in this room with us. So that's what we're doing. We're protecting also the rights of the other person to not have to inhale that in the room.
Okay, fair enough. Jessica, from your point of view, where do you see the road taking us in terms of dealing with the public, trying to make an impression on people, especially young people, not to smoke?
Well, I think, what I always try to remind people when we're talking about the need for prevention dollars, is that the tobacco companies never stop, right? They're always 100 steps ahead of us and have a whole lot more money than we ever will. And that's why they're great there now in the e-cigarette industry. And, they...
It's the same companies?
Absolutely.
Oh, it's the same companies. I thought it might have been some young startup high-techy guys.
Oh.
It's the same companies that were running tobacco all these years that are doing...
Because they
Oh, you heard it here on ThinkTech.
when they saw the success of it, they all started getting into it. So they all either create their own or they started buying out the smaller companies. So they are definitely in the e-cigarette industry, and that's why when we look at what's happening with e-cigarettes, you can go back 40 years and it's the same playbook that they're going back to.
Ooh.
And
Gets my dander up.
It does. And so, we look at this huge need to, because again, we're 1,000 steps back, right? They have been working on this for the last few years. We're now playing catch up, looking at what we can do to start curbing this trend. In a 2-year period, we saw our youth rates quadruple in middle school and triple in high school in Hawaii, and we are higher than the national average. So we know that we have a serious issue in Hawaii that we need to start tackling. And that's really, I think, where our future is going to look at. When we talk about the initiative that we're working on now, raising the age of sale to 21, that includes all tobacco products and electronic smoking devices. Mm-hmm. And the reason we see this as an important measure, it's really a great prevention tool, is because we know from research that although kids experiment before the legal age of 18, most of them don't transition to regular use until they have access to the product, when they have legal access. So if we can delay their access to products to 21, we know that we will have a significant impact on the number of youth who become regular smokers.
We've got to teach them, show them the dangers, the risks. We've got to connect this up with their wish. Hopefully the millenniums have this wish, the wish to serve the common good, because this is not just personal, it's common good. So Lola, I want to give you the last word. You You can face that camera over there.
Okay.
Tell the people what the Department of Health would like them to take away from this discussion.
I want you to know that prevention works and that we've used this money, which you've allowed us to, in public trust, to use for prevention, and that, you know, our youth have a healthier tomorrow because we have these dollars for the Tobacco Prevention and Control Trust Fund and for the Department of Health's chronic disease programs. And we want your voices also. We want you to speak up and to tell us that you want us to keep doing this job on your behalf, because we don't want to see our kids go the way of other states when they lost their tobacco settlement special fund to pave roads and to pay for other things. We want it to go for public health.
Stand up, Hawaii, and stop smoking.
Thank you.
That's Lola Irvin. She is Department of Health Tobacco Settlement Special Project Manager, and Jessica Yamauchi, Executive Director of the Coalition for Tobacco-Free Hawaii. Here we are on Hawaii, the state of good health, and we're reminding you that smoking still kills. Thank you so much, ladies.
Thank you.
Thank you.
Aloha.